Can everyone see my screen?
Yes.
Great. Okay, so my name is Crystal Aguilar. I am the MTO project manager and lead agency coordinator here with Project Amistad. We are actually located in El Paso, Texas. So I'll get started. I wanted to give you guys a brief overview of Swart WTEP. So it's the Far West Texas El Paso Regional Transportation Coordination Committee, or WTEP. Kind of what we do and as the lead agency and our best practices and just some accomplishments to give you all an idea. So we'll get started. So we do, we are in charge of Region 8 for the Upper Rio Grande. So for those of you that are not familiar with the area, that would be the El Paso, Hudspeth, Culberson, Jeff Davis, Presidio, and Brewster counties. So what's the purpose? So in 2006, statewide coordination of public transportation was established. Why? So to eliminate waste in the provision of public transportation services, to generate efficiencies that will permit increased levels, and to just further the state's efforts in reducing air pollution. The Texas Department of Transportation, or TxDOT, through their Public Transportation Division, is responsible for monitoring, guiding, and the funding, of course, as most of you are aware. So why regional planning? So a plan for a more efficient and effective network of public transportation services, of course, is needed. We need to identify the resources and get the right people in the right places to determine our desired destinations. To have communities come together to develop, of course, our 5-year transportation plan, identify inventories of transportation resources available, and to complete comprehensive needs assessments and gap analysis in our region. Our mission, so WTEP's mission is to facilitate the coordination of transportation resources to provide a customer-centered, accountable, and effective and efficient transit system for the general public of the 6-county Far West Texas El Paso region. Wanted to talk a little bit about our goals, of course, goals 1 through 3, to maintain an inclusive and sustainable planning process, fill unacceptable gaps in service. That's always a big one, and really, I guess, one that we all as groups strive to meet and to fill. Provide technical assistance and training to transit providers. Our goals 4 through 6, we want to ensure broad public knowledge. I believe it was Katie who shared earlier that one of the biggest challenges when they had their forums was to just educate the public on the type of services that are available in the area. And I think that's probably a challenge here too, because a lot of people don't know what those are and are really curious and surprised to know what services are available in the areas. We of course want to work to eliminate barriers. And of course, enhance the mobility of older adults and persons with disabilities. So a few of our achievements, we had a successful transportation summit in July of 2019. That was a very big one for us because that gave us a lot of networking opportunity and to meet people from the area and identify a lot of the challenges. We did have some panel discussions. We provided information to the public and attendees. We participated in public meetings. We have our County Commissioner Pettis' welcoming address. We had a lot of participation also by TxDOT Upper Management. We had 75 attendees. We reported on statuses, and then this also gave us the opportunities to engage and attract new stakeholders, which is always something that we're trying to do as well. Just a few of our pictures from our panelists there. We did have several panelists, and that was really helpful in opening up questions and challenges and gaps as well. So in terms of our partners in implementation and how we got from implementation to fully achieved and identifying new gaps. So again, one of our biggest successes and opportunities to connect was through our 2019 Transportation Summit. We had the opportunity to meet with dialysis centers, to network, to talk to people in our community. We discussed and shared survey results, as well as also provided surveys at and after the Transportation Summit. We were really just surprised to hear about some of the challenges, and it was really eye-opening to hear from the dialysis centers and just to go over some of the statistics in the community and the surrounding areas as well. And then we also touched base a lot on what the impact would be without transportation services and non-emergency medical transportation services. Something nice about Project Amistad is that we're really a one-stop shop and we're a social services agency. So within our own agency, we have a lot of networking and partners that we can get in contact with and really just provide that I guess that need to the people in case they don't know where, or we just have to make a connection for them. So that's kind of nice about our agency, that we are in essence a one-stop shop social services agency. Some of our stakeholders and affiliates, we do partner with the ADTRC here with Amistad, with the Mary Group, just to give you an idea of some of our stakeholders and affiliates, which make, of course, our partnerships and stakeholders and just the involvement a lot easier and a lot more seamless. Our 2020 steering committee members for WETAP, we have our officers here listed. We have our chair who is with the County of El Paso. We have our vice chair with the City of Socorro, Secretary of Village of Vinton, and then we have members here within Amistad. We have Rosario Fernandez, who's also on this call. She is with Amistad. We have partners with Big Bend Community Action, the Area Agency on Aging, and then we also have other partners with other entities such as the Mary Group, which is also very nice because we get just a range of issues and kind of just open it to other issues outside of the typical stakeholders or partners. Partner communication, I think, is key. I think that's been a challenge for everybody right now, especially during these times, only because it's just been challenging. It's always nice to have the face-to-face person, so this is definitely a new I guess, age or area for everybody, but nonetheless, luckily we're blessed with having all of these platforms to be able to communicate, and we've just continued to do that. It's been a challenge for us, but we've continued our meetings, our planning and engagement. Our stakeholders and partners are invited to every meeting, and they're kept up to date, whether it's via email or just sending something like a mass email out or a notification to everyone. Currently, our meetings are conducted via Zoom. That seems to be the platform right now that we're pretty much consistent in staying with, and that's worked really well. Our website is also frequently updated. We do post meeting information there, any special events. We have our meeting calendar, which I'll share a little bit later, up there as well. And I really liked that, I believe it was Katie mentioned that the social media presence, that's something that's very much involved right now. And so that would be awesome to even, consider doing it here in the near future as well. We have our regular meetings and they've stayed consistent even through the pandemic. Our steering committee meetings are held every month on the first Thursday of the month. And so really this meeting is to plan for any agenda items for our stakeholders to review and approve. We have our stakeholder meetings that are held every other month on the third Thursday of the month. We typically met here on site, but of course, like I mentioned, due to the pandemic, we are meeting via Zoom. And then of course, COVID has posed challenges to us all, but we continue to meet virtually. I mentioned that we have special meetings like the Transportation Summit. We also have additional special meetings for planning, for any bylaw revisions, things of that nature. And it just gives us the opportunity to meet with our steering committee, with our stakeholders, and just come together and identify any challenges that we're currently facing. I talked a little bit about our WETAP meeting schedule, which is posted on our website. Just wanted to show a picture of that for your reference. And then of course we have our gobisco.org, which is our website, which is frequently updated. And then you can also locate information listed there. And that was all I had. Does anybody have any questions or comments, anything I can answer?
Great. Thank you, Crystal. We'll give folks some time to put together some questions.
Sure.
Yeah, we can get that ready. Thank you so much. That was
sure. Thank you for having us. Thank you.
Yeah, that was really good. Thank you for that. And next we've got Sarah Hidalgo-Cook from Swart, and I see Sarah's already got her camera on. So
yes, how are you? Can y'all hear me?
Yeah. Yes.
Trying to share my screen so I can bring up the PowerPoint here. Can y'all see that?
Not yet.
Okay, it does not want to come up. Kari, do you by chance have that
I do.
available?
Yeah.
It's not giving me
Okay, give me just a sec to get it shared.
all right. Well, hello everybody. So Kari's gonna, while she brings up my PowerPoint, which is actually extremely short, I kind of just wanted to get to the bones of how Swart has been able to be successful in acquiring partnerships and of all different types, all different levels. Let's see if Kari can get it up.
Yep, I am just about to share my screen. There we go. Y'all should be able to see it.
Okay, let me get it come up here. There it is. Sorry, it's lagging in our area. Connectivity problems. Okay, well, again, my name is Sarah Cook, and I'm the General Manager for Southwest Area Regional Transit District, known as Swart. And let me go ahead and go to the next slide, Kari, I think, if you don't mind.
Yep.
All right, so we're in Region 24, which is the Middle Rio Grande region of Texas. There's 9 counties in our region, and there's 2 rural transit districts, ourselves and then the City of Del Rio Transportation Department, and their director is Elsa Reyes. And we actually work hand in hand regionally, even though Swart is the lead agency for transportation planning. Okay. You can go ahead and switch over to the next one. There you go. So we actually look at our partnerships in 3 different categories, and we've been successful over the last 10 years or more in gathering partnerships, especially in the last 5 years. But we look at them as contract partnerships is one way. Those are your normal transit service contracts, and we have all different kinds. We have contracts with churches and adult daycares, junior college, as well as Chamber of Commerce, local libraries, clinics, hospitals, all different types of programs. And we try to not try to make the process so difficult for them when it comes to contracting, putting together a contract between us as partners. We try to keep it as streamlined and as simple as possible. The next is referral contracts, and these are important for us because a lot of times there's not anything that they can bring to the table in forms of money or in other forms, but referral is extremely integral for us. For instance, we have a referral contract currently with a clinic in Eagle Pass and a clinic here in Uvalde, and those contracts, those referrals have been extremely important for us to be able to have other contacts that they've been able to bring our way and vice versa. And so those have become extremely important for us. And I know that sometimes people go, well, it's just a referral. But those are important if you actively use them like they should be. And then we have other contracts that are, for instance, not necessarily service contracts, but partnership contracts with maybe somebody that leases space from us, or contracts with us to provide maybe some maintenance services or detailing on vehicles, or technical assistance, training, those type of things. And so we gather our partnerships in those three areas. But they've been extremely, in the last 5 years, have been extremely important to us. One, because where we used to provide non-emergency medical transportation up until 2018, there really wasn't a need for us to have to actively go look for local match for our federal dollars. And then when we decided to move away from providing that service in 2018, it really forced our hand to go out there and look for these partnerships and bringing other people to the table. For those of you that provide non-emergency medical transportation, you realize that a lot of your day-to-day services are geared around that particular contract. And when you no longer have it, then you have to start being creative on how you're going to increase your public transportation and bring others to the table, other partners, and maybe unconventional partners that you've never had before. 2 years down the line, now that we moved away from that, we've actually come back around full circle to providing non-emergency medical transportation on limited capacity, only because we wanted to make sure that we wanted to stay true to all of the partnerships that we had at the table and not just geared towards NEMT services. And so that became kind of an internal discussion with management when we decided to go back to non-emergency medical transportation services and say, okay, look, we can't let it lead our lives on a day-to-day basis as it was before, because we have all these other partners that now we have to pay attention to. And so those are the internal conversations that we have. Moving over to our stakeholders are not just necessarily our steering committee, but we do have a large steering committee. It is made up of 17 members from all walks of life within our entire region, but that meet quarterly. And it's very hard to get that large of a group to meet quarterly, but we do meet quarterly. They're very active. But we do have other stakeholders that are not part of that committee. And so we have smaller focus groups that also meet. Now, we've concentrated in 3 areas with our focus groups, one being veteran service officers. And so that is a very lively group. It is a group that some of those veteran service officers are full-time, and some are part-time, and some are volunteer with their counties. So it does make it a little difficult at times to try to bring them all to the table, but we try to work around their schedules as much as possible. The next group that we have a focus group with is the renal care facilities, and this is with their caseworkers. And this has been another integral group for us, because it's not only those writers that we provide the services to that we have those discussions with the caseworkers, but they actually call us and say, you know what, we have this new patient, they don't qualify for NEMT services, but can you work with them on a some type of basis providing services? Do you have some kind of discounted ridership for them? So they actually call us versus us just trying to disseminate information to them and get information from them. And then the last one has to deal with MHDD, dealing with the mental health. That's a big issue in our area, and it's actually led us to receive a grant or a foundation grant in the last year through a mental health group, a mental health foundation. So that did open up the door for us in other areas to acquire additional funding or alternative funding that you're actually able to use as match as well. So that really helped out. And that particular grant, a foundation grant that we received, it was about $55,000 to disseminate and educate our region on the importance of filling out the Census 2020. And so, that was something that had nothing to do with transit, but the fact that we encounter so many riders on a daily basis, and we see so many different groups and organizations over time, that we were able to disseminate this information and meet the requirement of the foundation grant and still receive funds for it. And then we have other regional groups that we are a part of, not necessarily groups that we spearhead and or spearhead and facilitate, but are just members of other regional groups. Like there is a veterans regional group that then within the COG that plans job fairs for veterans and other events. There's also other groups that are through maybe the housing authorities or healthcare or economic development, and so it's those partnerships are really important to go and actively become part of their groups, and the people that you meet, the networking that happens through those type of meetings are very important, because believe it or not, many times over, I've received a call from somebody that I just met very briefly at a regional meeting or even at a city meeting, a local meeting, and that they've called us back and said, I really want some more information about your services. These are my needs. Maybe we can work something out. So those are important as well. And then the other partnerships that we look at are just those handshake relationships, just those that you see maybe in church or in a restaurant or in passing at the store, that they know who you are, they know who your services are, and they just may need to reach out for something, and vice versa. One of those areas that are important for us, or that's where we really look to get those letters of support, not only from those that we have contracts with and formal partnership contracts with, but just those in passing. I'll give you an example. We do not have a contract with the local school district, but yet the local school districts support us with letters of support, because they know that if they ever need to refer somebody to us, they're able to refer families and students or parents to us, and vice versa. We do the same thing, but they're there for those letters of support. And this could be locally, this could be regionally, this could be statewide. There's also a group that I deal with nationally called the Rural Development Leadership Network, and I sit in on just a monthly health call with them, but whenever I need them, they really give us that support that we need in partnership of letters of support. So those are things to think about. You want to go to the next one, Kari? And the other question is, how do we keep them engaged? And this is important. I think this is something that everybody struggles with, especially now with the pandemic, but even prior to that. How do we keep these partners and these focus groups engaged? And it's very easy, and it's very simple. A lot of times they're very busy, they're stretched thin, they cover many areas, especially those renal care caseworkers. They cover large areas with many counties in it, not just the counties that we serve. So a lot of times it's just easy to have an email blast. Very simple. 9 times out of 10, I will get a response back from my email blast going, thank you so much for the services. I let them know what's going on within Swart and within the city of Del Rio and our region, where maybe we've met some barriers, where some of our successes are. An example is one of our counties does not locally provide local match into our program. And so, every year I list in my email blast, which counties and cities have supported public trans in the form of a donation. And, I've had them come back and go, well, why doesn't this county do that? Is there anything I can do? Can I write the commissioner's court? Can I write the city council? And so that's where those partnerships really come in handy. They kind of are your voices and can be your best advocates. Referral contracts, like I mentioned before, keep them engaged. Focus on marketing. We really work with our referral contracts. For instance, the COG, we don't necessarily have a partnership contract with them, but we have a a marketing contract with them where they actually market on our buses through bus wraps, and then we turn around and refer. And so we receive funding through the bus wraps, and we work with them to refer clients to them. So it's kind of a win-win situation. And basically, you know, that's the mission. You know, we kind of work with them on what our mission is, and then support their mission as well. And then again, the letters of support are big. If I write a letter of support for someone, and they write one for me, it's kind of, you know, you scratch my back, I'll scratch yours. When they need a letter of support, we provide it, and vice versa. And that also goes to, could be just you know, some type of endorsement, not necessarily a formal letter of support, but maybe just an endorsement on maybe some kind of ad campaign or PSA or something to that extent. And you know, and so for us, we've been able to garner, you know, maybe 30 plus partnerships and have those in place. We try to keep it simple. Like I said, we don't try to make the contracts so extravagant that nobody wants to read them or even want to renew them. We make the renewal on those partnership contracts very simple. After the first year, it's on a month-to-month basis. So you don't have to come back and renew all these contracts again unless you need to add an addendum or some type of change throughout the year. And basically just be an advocate for your services, but be an advocate for your partners. And I think that's what's key for us. And like I said, it's very simple, but it's been very successful for us. And I can entertain any questions.
Let's get everything started back up on my side. At this point, I think we'll send folks off into the breakout session so we can talk about what y'all have just heard and get a sense of some questions that you want to ask and share some ideas with the other folks in your room. If I can find any questions, and if I do miss your question, feel free to put it in the chat again. So let's see. Here we have one from Cullen, and I believe this is directed at Crystal. How difficult was it to gather all the organizations to set up the Transit Summit?
Hi, this is Crystal. So it was challenging. Of course, it was pre-pandemic time, so a lot of the being able to meet in person was a lot easier. Having organized distribution lists for all your partners and stakeholders, and you know, readily available contact numbers really helped as well. There were challenges, you know, nonetheless, on people returning calls or emails or even some participation, but at least for our group towards the end, we were happy to see that there was a lot of participation. We had volunteers, we had some of our partners like AmeriGroup provide bags with like goodies, things of that nature. So it was overall a pretty good experience with a lot of involvement.
Great, thank you. Let me see. I think that's the only question I've had so far. Surely there are more questions.
Hey, Kari, this is Sarah. Can you hear me?
Yes, yes.
Okay, so in our discussion, in our chat room, we talked about how mobility managers were utilized in helping gather partnerships and how agencies are funding those particular positions.
Oh, that's interesting. Would you mind expanding a little bit on what you...
Sure. So, for instance, in our particular agency, our mobility manager is used primarily to go out and advocate for the agency, as well as try to form partnerships or find opportunities for partnerships throughout the region. And so we discussed a little bit about that, but then we also discussed, of course, others in the agency that support that, not just necessarily mobility managers, but operations managers and so forth. But then we also discussed, there was a question in our chat room about how mobility managers are being funded, how we're funding the salaries for that. So we discussed a little bit about how, for instance, in our case, some of the activities of the mobility manager is funded through 5310. And then we have other support grants, foundation grants that we recently just completed that funded a portion of the salary as well. And then, of course, we work really hard to be able to incorporate the cost of those salaries in our federal and state budgets as well. But if we can get it through other avenues, other grants, then we try to do it that way.
Yeah, it sounds like I should have a session with you on how you've been able to get other foundation grants and other funding. I know that's something that everyone's curious about.
Well, and again, those things come through just having those referral partnerships. And that's how we found out about this particular grant, some other grants that we've applied for, not necessarily been successful in getting, but we're very excited to have gotten our first foundation grant, because that really opens the door for other foundations to say, okay, well, yeah, they've been successful in disseminating and providing services through a foundation grant. So it's kind of one of those things where you finally get your foot in the door, and hopefully it opens up the door a little bit more for you.
To be able to, yeah, no, that makes sense. Let me see, I've had a question come up. In our breakout group, there was a question as to what situations TxDOT would or would not fund mobility managers. One person said that TxDOT said they don't really fund that, while others had a different experience. I'm taking a deep breath, because when it comes to mobility management, it can be very complicated, and it depends on what specific activities are being done as mobility management, because that's such a broad umbrella term for a lot of different activities. So it would be something where I know that's typically funded through 5310. I believe you can get some 5311 funding for it as well. You'd want to be talking to your PTC and your and the 5310 program manager, Lisa Johnson, about what you've got in mind with it. And those kinds of conversations, this is a great time to have that kind of conversation. Anytime before the application period opens is the best time to be talking about those kinds of ideas. But yeah, definitely mobility management is kind of right at the heart of getting engagement and crossing that over with in your ridership. Let's see, I had one more comment. Okay. We discussed how typical it is for identified gaps from plan to plan still being unmet. It was a question I had as a newbie. So I would open that up to the group. If you're experiencing now, you've seen, or is it typical that you've got identified gaps that have persisted from one plan to the next? And then I guess while you all are thinking about that, we've had another question come up. Does mobility as a service count as mobility management? Just curious. So mobility management doesn't cover the cost of operating the service. I'm trying to think of the best way to describe it. It's almost like a concierge. In one respect, if it's connecting riders with the means of transportation, that's the best explanation I have, kind of as an abbreviation, would be like a concierge in terms of getting the person set up with the most appropriate means. The idea being it doesn't necessarily matter to the person how they're getting there, as long as they're able to make the trip when they want to make the trip. So it would depend on what the relationship was with mobility as a service. And then Nancy just pointed out, travel training is also something that's eligible under mobility management, which would be working on an individual basis with people to get them to the point where they can either ride at all, or ride, maybe they've been able to use demand response getting someone the tools and the assistance they need so that they can ride the fixed route or something that has greater access to it. Travel training is also an opportunity for some partnerships. I know in several areas, it's the Centers for Independent Living who will conduct the travel training under a contract or a relationship with the transit district. All right. So did we have any responses on unmet needs that go from plan to plan?
Kari, this is Sarah.
Yeah.
So I guess my question to that is, are they talking from plan to plan within the organization, from one plan to the other, or maybe regionally when, let's say that there's a gap in service with transit, but also a gap in service with maybe healthcare or nutrition, dealing with the same population, like maybe a very low income or elderly disabled or children. I guess that's what I was trying to figure out what they meant by that.
Yeah, and that's actually, I'm gonna give you're gonna roll your eyes. I'm gonna give another plug for the forums on this, because that might be a better way to have an ongoing sort of open conversation. To go ahead and post that. I'll be sending out links to the forums and links when we get more information up there, but that might be an easier way for you all to communicate directly and get clarification on things.
And this is Jamila, Carrie. Since I posted it, I just wanted to clarify in reading it, this will be the first plan update that I'm involved in. And so in looking at our past plans, there's some things that have just kind of moved, right? And will likely move into this plan. And I was just curious as to how, and it's just specifically focused on transportation and public transportation gaps. So I was just curious as to if that tends to happen with other regions as well, and what sort of thought has been given in terms of, okay, for the really hard ones, right, the really tough gaps, if people have been successful at sort of cracking that nut and getting those things taken care of. But I agree. I think the forum would be a good place to maybe ferret out some of those that have persisted, but then one day something changed.
Right. And I think for a lot of those, it might be a case of small bites where you've got the overall gap that's been identified is something that's large, and 5 years isn't going to be enough to cover it. But being able to kind of break that down and see what parts of that can we meet incrementally.
Right.
Let's see, I had another question come up. Our region has a gap in languages other than English. Access for riders that need resources in languages other than English or Spanish is very hard. Yeah, it would be. We have people who speak Swahili, Burmese, etc., and translation services are underfunded or unavailable a majority of the time. I believe that there are some services that are available, especially via smartphone, that can help with that kind of service. And I'm actually going to make a note of that and see if I can get back to you with that information. And actually, I'll go ahead and post it in the forum. This is a question that we've had internally within TxDOT. We've been looking at our Title VI plan and limited English proficiency and trying to figure out, okay, well, we're in Texas. Spanish is obviously the number one other language. But from there, it's a whole spectrum, and it really depends on what part of the state you're in. But that's that's an important question. I'll make a note. There we go. To get some information on that, because that is important. It's reaching those communities. One of the groups that I found when I was talking to some folks across the state were Refugee Services of Texas. I can put their contact information up on the forums as well, but that's a population that would intersect with seniors, individuals with disabilities, job seekers, low income, So that would be kind of a way to hit across the spectrum with an underserved population.